Good day, everyone. My name is Francisca O.E. I'm a consultant physician and cardiologist in Olabisi Onabanjo University Teaching Hospital, where I practice cardiology, adult cardiology. Well, today we want to talk about cardiovascular disease. What are cardiovascular disease? This is anything affecting the heart and the vessels. The vessels are like pipes that are connected to the heart. They carry blood from the heart to other parts of the body. So cardiovascular disease majorly are those diseases that affect the heart itself and the vessels surrounding it. Now, what are the major types of cardiovascular disease? Basically, we talk about coronary heart disease. This is disease affecting the major vessels that connect to the heart, and they present in so many ways. We also have the peripheral arterial disease. These are when there's affectation of the vessels that supply blood to the lower limbs of our body. We also have transient ischemic attack and stroke. This is when you have affectation of the vessels affecting the brain. Okay, now, cardiovascular disease is very important because it has been said to account for major cause of death worldwide, both locally and globally. And it is one of those that causes about 17.9 million of deaths, according to WHO. It accounts for over 3.5% of global deaths. And this cardiovascular disease occur more in low and middle income countries. It's accounting for about 85% of non-communicable disease deaths. Now, why are we worried about cardiovascular disease? It's important to know because the bedrock is atherosclerosis, meaning blockage of our vessels. How can people that have cardiovascular disease present? Why are we worried about it? If you have cardiovascular disease, that means that one of your major vessels is blocked, and you can present with chest pain. A lot of people as they age have chest pain, and this chest pain of concern to us could be angina. That means the vessel going to the heart is blocked and is short of blood. Okay, and this can present with chronic chest pain. Sometimes the chest pain is worse with exercise. Sometimes it gets badder. Even when you are resting, you have such chest pain. It becomes unstable. And at the long run, it can lead to what we call myocardial infarction, which is commonly called heart attack. I mean, you find somebody that suddenly slumps down, holding the chest. They have a chest pain, and before you could say anything, they are dead. It could also be a cause of sudden death. In our environment, it's called heart attack. But actually what it means is that the major vessel is blocked and there is low oxygenated blood supplying that part of the body, especially the heart this time around. Now, what are those things that can predispose someone to having a heart attack? There are risk factors. There is no one cause. There are multifactorial causes, and these are the risk factors. These risk factors are divided into two major groups. We have the modifiable risk factors and the non-modifiable risk factors, meaning there are some things we can handle, there are some chances we can change, and there are some we cannot change. Things like age. As the age increases, the vessels get thicker, they get narrower, they get more stiff, and so they are unable to be more elastic to carry blood to major parts of the body. We cannot do anything about age. Sex also, the male sex have been found to be more predisposed to heart attack, to all forms of cardiovascular disease. We cannot change your gender. You cannot change the fact that there's a family history. Now, where family history comes important is that when you have a family history of sudden death occurring in a male greater than 55 years old, it's said to have cardiovascular disease of importance. Or you have a sudden cardiac death in a family, in a woman that is less than 65 years old. I mean, that is of significant importance. Now, we cannot change that. But what are those things we can change that will reduce our risk of cardiovascular disease? One is elevated blood pressure. Hypertension is common in our environment and is becoming a global problem, especially even in the young adults. In those days, he said it's disease of the elderly, but now we know we have it even as low as 25 years. Once there's an increase in your blood pressure more than 135/85 millimeters of mercury, then that person is likely to have elevated blood pressure. Blood pressure itself is a major significant risk for cardiovascular disease. Also is diabetes mellitus. Also is physical inactivity, smoking, alcohol intake, obesity, sedentary lifestyle, in physical inactivity. All these are risk factors that we can control. Another important risk factor is increased cholesterol level, hypercholesterolemia. What this does is that it goes to block the arteries. Once the fatty streaks builds up within the arteries are blocked, and then you have narrowing, and so there is reduced blood supply to that part of the body that vessel is supplying. These are risk factors that we can take care of if we are mindful of what we do. So what do we do? How can we take care of ourselves to prevent cardiovascular disease? Preventive measures. Preventive measures largely have to do with modifying our lifestyle, what we do on a daily basis. First thing is to be active as much as possible. When you are active, then you are able to sort out a lot of issues that have to do with stiffening of your arterial wall. So physical activity is important. It is recommended, cardiologists recommend that brisk walking, that means fast walking at least 30 minutes every day, 3 times a week minimum, can help to open up your arteries. 2, avoid obesity. How can you avoid this? By what you eat. Avoid eating a lot of fatty containing foods. Also, check your numbers regularly. Check your blood pressure, especially when there's a family history of hypertension. It is important to check what your numbers are at least once a month. And if you are found to have elevated blood pressure, there are so many things that you can do to bring it down, even before it gets to use of medications. So we talk about checking your blood pressure regularly. Another thing is to avoid smoking. It's said that if you cannot stop smoking, there's no point seeking help, because the cigarette smoke itself is toxic to the vessels. It burns out your vessels. Also, we need to maintain healthy diets. Eating healthily, maintaining balanced diet really has to do with what you take in. Avoid fatty foods. Avoid foods that have high cholesterol. Things like polyunsaturated fats, bad oils, too much of meat, too much of offals. People say, oh, I'm not going to take red meat, I'm going to take roundabout, shaki, pomo. No, those ones are high containing cholesterol diets, and we say you should avoid that, because those ones will help your atherosclerosis to build up fast. Also, it's important to be very active. We cannot overemphasize that we need to avoid physical inactivity, which will also help us to avoid obesity and help us to maintain a good weight. Now, beyond our preventive measures, we need to go for regular checkups in the hospital. There is a way the cardiologists add together all your risk factors to be able to predict what is your 10 years risk of developing a cardiovascular disease. Nobody wants to end up with stroke or a heart attack or a transient ischemic attack or a heart failure whatsoever. You can only know your risk if you visit a health practitioner who will calculate your risks, look at what are those things that you can control, and be able to tell you, oh, the way to predict and tell you this is what you should control, this is what you should watch out for. Now, even if you are told to have any of these risk factors, that is high cholesterol level, hypertension, diabetes, or obesity, whatever may be your risk factor, there are medications to sort them out. And a stitch in time saves. Now, it's important to go to a specialist, let them identify your risk, and be able to give you a guideline-directed therapy, meaning that they will choose what drug is best for you, for your age, for your sex, and for your numbers. So it's important that we have all these checks up, and they'll be able to take adequate medical therapy. Now, it is not a death sentence. If you are found to have risk factor, prevention is better than cure. When you are giving medications, you are advised to take them regularly, and you still continue regular follow-up checks, because that will help to be able to ascertain, is your risk reducing or not? Are you getting it right or not? So I'll enjoin you all. If there's any chest pain you are not sure of, anyone you are not sure of, is it a cardiovascular risk or not, please speak to a health practitioner rather than using all sorts of medications which can compound your problem. Thank you.